Brigstowe is based in Bristol. We support people living with HIV and other long-term health conditions. It's estimated there are over 100,000 people in the UK living with HIV, and 1 in 16 don't know that they're living with the virus. Because of stigma, when people get their diagnosis, they can experience feelings of shame, depression and isolation. We really want people to know that if you're diagnosed early, you can have a totally normal lifespan, and if you're on effective treatment, then you can't pass the virus on to sexual partners.
I was diagnosed in 2017. I remember at the time my mantra was just, I'm okay, I'm fine. But looking back, I just wasn't.
We run a service called Positive Voices, which is our HIV peer mentoring program.
We train them up to be mentors, and then we match them up with people who are newly diagnosed or struggling to live with a condition. And they can spend about an hour a week being able to talk about anything that's bothering them.
It's just this instant recognition and knowledge of what I was going through.
In 2018, we were approached by Bristol Community Health, who had seen the great outcomes of our Positive Voices programme, and they wanted to see if that approach could be used for other long-term health conditions. So they commissioned us to do a pilot for type 2 diabetes. And that service was then recommissioned by Serona Care and Health to do peer support groups for people with long COVID.
The outcomes have been really fantastic. People that went through the programme are more likely to manage their long-term condition well, are less likely to receive hospital care and treatment, and are more likely to stay well in the long term.
Brigstowe's HIV awareness training makes sure that professionals are aware of the transmission risks, how people can be tested and receive treatment if they're living with HIV.
We have a strong relationship with Avon and Somerset Police. We've trained over 300 of their workforce. That includes frontline police officers and people from their training department. We're really pleased that our model of training has been recognised by the National AIDS Trust.
People of African and Caribbean heritage communities represent 2% of the population, but 30% of the diagnosis of HIV. It's very clear that there are inequalities that need to be faced. Common Ambition Bristol is a community-powered co-production project. The aim is to increase HIV testing in African and Caribbean heritage communities, whilst also decreasing stigma.
I received a call to say, you HIV positive. I'm not British, so I didn't even have like a GP. I was so depressed and I was crying.
Our Migrant Asylum and Support Service works with migrants, asylum seekers and refugees. They're facing a lot of difficulties around destitution, receiving their diagnosis and immigration difficulties as well, so we really go on that journey with them. Through Brigstowe's influence and tenacity, in 2019 Bristol became a fast-track city.
Fast Track Cities is an initiative to end HIV by 2030. Brigstowe were absolutely instrumental. They organised focus groups and consultation events with lots of stakeholders, and they're really enthusiastic, so that you've got that passion which comes through in a really warm organisation. They're very welcoming.
I'm so grateful, honestly. I am. They changed my life.